the why human trafficking work is needed, to fight for the freedom of modern-day slaves. But love, passion, commitment isn't all you need to be an effective and successful anti-trafficking advocate. Learn the how. I'm Dr. Celia Williamson, Director of the Human Trafficking and Social Justice Institute at the University of Toledo. Welcome to the Emancipation Nation podcast, where I'll provide you with the latest and best methods, policy, and practice discussed by experienced experts in the field so that you can cut through the noise, save time, and be about the work of saving lives.
All right, today I'm talking to Dr. Lauren Martin. She has a PhD in anthropology. She's at the University of Minnesota. She spent several years since 2009 at the Urban Research Outreach and Engagement Center, which is a research center that's off campus and engaged in a community that's been disinvested. So she has been with the people for a very long time and doing human trafficking research and advocacy. And so she's here today to talk about a variety of issues that are important to us and things that we can go out and do in our communities. So welcome, Lauren.
Thank you. Hi.
Yeah. So Lauren, you've been involved in all kinds of really cool things, and not to mention that you are just a really cool person that is involved with all kinds of walks of life, people of color, different socioeconomic statuses. You like to be in the community with the people. I know that.
Yeah.
Can you tell us, I know you've been involved in this, the state of Minnesota sort of expanding this idea of safe harbor. So what have you guys been doing in that area?
Sure. Well, thank you so much for inviting me. I'm really thrilled to talk with you today. And yeah, we've been doing some exciting things in Minnesota around safe harbor. In 2011, Minnesota passed safe harbor for youth. And then we created this sunrise clause to allow the state to figure out, like, okay, if we're going to change the laws and decriminalize young people who are involved in transactional sex, like what systems are going to be in place to help those young people.
So Lauren, explain what the safe harbor law is.
Sure. So the safe harbor law, the way it passed in Minnesota, has a couple different components. First of all, it recategorizes young people who are involved in transactional sex from being considered to be delinquents, juvenile delinquents, and criminalized, right? So they used to be arrested for prostitution, as young as 13 and 14. So it totally changed that. So young people are viewed as victims of commercial sexual exploitation and youth in need of protection. The idea is that Minnesota is going to take care of young people instead of arresting them. It also increased penalties for people who purchase sex from a juvenile. It made that felony level crime as opposed to a misdemeanor, which it was prior to safe harbor. And then it also did some things around changing child protection statutes, making involvement in commercial sex something that should be reported to child protection.
Lots of states have safe harbor laws passed, right? But you guys went and did something, you expanded that law.
Yeah, so we've done a couple things that are different. We are looking to expand, but the one thing that we did that's really different than any other state, as far as I'm aware, most states have this safe harbor in a criminal justice or, more of a law enforcement context. Sometimes it's a diversion court. In Minnesota, it's part of our Minnesota Department of Health. So we're looking at it as a public health issue in Minnesota. And what we just did recently, the Minnesota State Legislature wanted to understand what would it mean to actually remove the age limit of safe harbor. So in Minnesota, the criminalization or decriminalization goes up until 18, and then we allow people access to supported services through our safe harbor no wrong door model up to age 24. So that's the other thing that's a little different about Minnesota. We actually have a funded network of regional navigators across the whole state and specialized housing. The legislature in Minnesota really wanted to know what would it mean to actually remove those age limits and make those services and supports available to adults. Really thinking about, and also thinking about decriminalizing prostitution for people who provide sex and people who would be considered, according to Minnesota state law, quote unquote, prostitutes. So decriminalizing that. We don't use that language in our work because most people view it as stigmatizing, but that's how our statutes refer to people. Yeah, they funded a statewide strategic planning process, which our team led in partnership with the Advocates for Human Rights and Rainbow Research, two other really awesome organizations in Minnesota. And we were able to talk with 394 people across the state. The state mandated that we talk to a huge range of people, including people with lived experience in prostitution and commercial sex, police, prosecutors, people from all different communities, American Indian people, people of color, immigrants. And then Minnesota is a pretty big state. We have half of the population roughly is in the metro area, and then half the population is dispersed across the state. So we have a lot of rural populations. So we were meant to talk to everyone in the state, including people on tribal reservations.
So you haven't passed the law, but you're having strategic planning meetings to do what?
Yep. So our primary question was, should Minnesota decriminalize prostitution for people who provide sex? And if so, what would that look like? Sometimes this model gets called the Nordic model. So sort of looking at expanded services and support and decriminalizing. What we learned, so we finished the strategic planning last summer. And what we learned is that phrase, the Nordic model, doesn't work for a lot of communities of color because it feels like it isn't for them to call it the Nordic model. So
yes.
Right? Because people were like, Nordic model, that sounds kind of weird. You know, I know it comes from the fact that that framework was originally developed in Scandinavia, the Nordic countries. So we don't call it Nordic model in our report. We call it partial decriminalization. So that's sort of what the legal framework would be. But really, we were able to engage really widely with people with lots of different experiences, lived experience in transactional sex. And I think we're able to do that because we used an action research approach, which means we had an advisory group of people with lived experience who really helped us fine-tune everything, the questions we asked, the approach we were taking. And kind of cool about that advisory group is we were able to engage people from all different types of experience in commercial sex, people who identified as survivors of trafficking, people who identified as independent providers, and also people who identified as sex workers. And what's cool about that is a lot of this work, there can be sort of a divide in perspective around legal framework and how people should be identified. And so we took the perspective that people should be able to self-identify and that we were just going to meet people where they were and how they wanted to identify. And
is that why you use the term transactional sex? Does that encompass, or who does that encompass?
Yeah, that's a good question. So part of our process was, again, to figure out language. And what we settled on, because we're really looking at prostitution laws in Minnesota, not just sex trafficking laws, this would encompass a wide range of people with lots of different experiences, right? Yeah, we use the term lived experience in transactional sex. For us, that encompasses people who identify as survivors, whether of trafficking or commercial sexual exploitation, and people who identify as sex workers. Mm-hmm. So, yeah, we use that phrase. And we use transactional sex instead of commercial sex because lots of people in our advisory group really wanted to make sure that we weren't losing that piece around people trading sex for a place to stay or for food or, with situations where a landlord might be exploiting somebody to trade sex in lieu of rent. Mm-hmm. So we wanted to make sure that we were not just focusing on that sort of commercial marketplace, as it were, but also on those other forms of sexual exploitation and transactional sex.
And so what's the difference in the way Minnesota sees commercial sexual exploitation of youth and sex trafficking of youth?
Just to clarify, from a research perspective, we're pretty clear that we don't tell people what their experiences are. We try to create research processes that are open and people can self-identify. But the safe harbor model really looks at young people, particularly under age 18. They don't make a clear distinction between sex trafficking and commercial sexual exploitation. They view juveniles involved in commercial sex as victims because they can't consent to be part of transactional sex. So the Safe Harbor Network includes all young people, victims of sex trafficking, and also young people just involved in survival sex or transactional sex of any kind. I don't know. Does that answer your question?
Yeah. And for adults, I'm sure you have included people that identify themselves as sex workers, like you said, those that identify themselves as sex trafficking victims. And then are there those that identify themselves as being involved in prostitution because of survival reasons?
Yeah, that's for sure. And where it gets really confusing, because we have these two different frameworks for thinking about commercial sex, we have the sex trafficking framework, which, when we're thinking about legal frameworks, it's really less about describing people's experiences and more about figuring out who's culpable of a crime. So it gets kind of tricky. Most people who we've worked with don't fit into these neat little buckets, right? Their life experience is so much more complicated than I'm this or I'm that. So in this process for Safe Harbor for All, that was the name of the project that we just finished, many people talked about moving, sometimes being a victim of trafficking, sometimes considering themselves more of an independent provider, or sometimes being exploited, just trying to kind of make it through and having all these different experiences and not necessarily knowing how exactly they want to identify in any given moment. Mm-hmm. So it just became clear that people's experience is so much more complex than what our kind of legal and terminological frameworks allow.
Exactly. So, what did you end up finding out? What's Minnesota going to do? What did they recommend?
Well, I don't know what Minnesota's going to do, but our report recommended that Minnesota move toward a partial decriminalization model. Most people agreed. Well, everyone agreed almost uniformly that arresting people for prostitution is harmful. It causes like a downward cycle. And it actually, in many cases, arresting someone for prostitution you're actually harming the people that we would like to be helping. Because a lot of times people who are victims of sex trafficking get arrested for prostitution.
Are you recommending that the sellers not be arrested or no one be arrested?
We are recommending that the sellers not be arrested. So that's why we call partial decriminalization.
Okay.
There were some people in the state who felt that we should not arrest sex buyers, but most people that we interviewed felt that sex buyers should still be subject to criminal penalty, particularly, and this was kind of a universal agreement. Everyone agreed that people who purchase sex from a minor or people who purchase sex from a trafficking victim should still be subject to criminal penalty. And there was actually a lot of area of agreement. I think one of the most exciting areas where everyone had a lot of energy to focus on was the idea that many people involved in transactional sex are actually victims of many other crimes around sexual assault, physical assault, harassment, stalking, and crimes against persons. But that because of criminalization, the police don't take those crimes seriously. So one area that we felt was really important for the state to look at was how to provide better police service to people who are involved in transactional sex. But I'll give you a clear example. Let's say somebody is sexually assaulted in the context of a commercial sex act. Oftentimes what will happen is if there's an arrest made, the police will charge that sex buyer with prostitution. They won't make a charge of sexual assault.
Somebody is going to be charged with the misdemeanor prostitution, and they're going to likely ignore the felony of sexual assault.
Exactly. And then if you think about how does that make the person who's providing the sex act feel? Like the assault doesn't matter.
Exactly. That leads to all of our HIV risks, poor mental health, post-traumatic stress disorder, substance abuse, because what do you do when you don't have access to justice, to coping mechanisms? And those things become not only emotionally expensive, but financially costly to a community.
Oh, for sure. And it just heightens stigma. It heightens marginalization.
Yes.
And it viscerally shows people that they don't matter. And that's a deep wound that our society causes people who are, in many cases, our most marginalized members of our communities.
Yes, yes.
So that's one area that we could work on right now that would make a huge difference. We wouldn't even need to change laws because, sexual assault is already illegal. And so is harassment. And, there's laws about all these things. But because of the stigma and misperceptions around transactional sex, those laws are not being enforced.
Yes. I mean, there was some many decades ago where law enforcement would just write on reports, NHI, no human involved, in sex assault cases with women who are victims who were also involved in prostitution.
Wow.
Yeah. I mean, we've come a little ways, but not far enough.
Yeah, in Minnesota, I hadn't heard that, but in my work with police officers and other people in community, I would hear sexual assault referred to as a quote unquote no pay.
Yes.
So that the crime would be, this sort of false idea and, dehumanizing idea that people involved in transactional sex can't be raped, or that you can't consider that rape. So this idea of no pay.
Yes, that's ridiculous.
Totally. So we were able to explore that. That was kind of a cool thing for me in this project to come full circle, because maybe 8 years ago, I'd worked with a bunch of survivors of sex trafficking and some police officers and some others to come up with some strategies. We called it safety on the street. We were trying to create a collaborative to make it easier for people involved in transactional sex to make reports to the police without having their warrants, their background check and warrants run, and, being arrested for prostitution. So it was kind of neat to come full circle and have that same piece come forward in the Safe Harbor for All project, and to be able to really make some strong recommendations to the state based on our data around that issue.
That's fantastic. And what will happen now? What are the next steps?
Well, so we submitted our report to the Minnesota Department of Health, who then submitted it to the legislature. And as far as I know, there'll be some legislative advocacy around aspects of the report. So people are looking at expungements and vacator as a kind of an immediate way to relieve some of the burden of criminalization.
And so explain what that.
So expungement is a process whereby a criminal record is sealed. It doesn't go away, but it's sort of sealed from view. And in Minnesota, each state has their own laws, but in Minnesota, there's a lot of criteria that have to be met in order for a case to be expunged. And this gets into broader criminal justice reform, not just related to human trafficking or prostitution. It's just really hard to steal a criminal record. And it's just like a ludicrous amount of paperwork that people have to do that's almost prohibitive, and it costs a lot of money. So we're looking at reforming.
So basically, I think what we have in Ohio, and I think what a lot of states have, and tell me if this is similar, if you've been involved as a sex trafficking victim, that's how they do it in my state. And if you have been forced or manipulated to commit crimes as a victim of sex trafficking, a lawyer can go in and argue to have that record expunged so that somebody can get a livable wage job and actually start their life over. Is that what you have in Minnesota?
Yeah, we have that, but the legal burden is really high. Like, people the amount of paperwork that has to be filed, and none of it's available online. You have to identify, I guess what I'm trying to say is, we have something on paper that looks really great, but then in practice, it becomes really difficult. So a person has to go to every county in which they had a previous charge and get a separate expungement per county.
Oh my God.
So, if somebody has, say, 15 arrests for prostitution in 4 different counties, they have to identify each of those arrests or convictions and petition each one individually. And, we know a lot of people who are involved in street-based prostitution who are also victims of trafficking have a lot of prostitution charges.
Yes. So
it just becomes prohibitive, and each one costs money. And if you fill the form in incorrectly, it gets rejected and you have to start over. So let's just say there's some room for improvement.
Yeah.
But the will is there. I mean, that's the good thing is I think there is a lot of will to make this process more streamlined and actually feasible for people.
That's excellent.
The other thing we looked at is vacator, which is a different legal mechanism. Vacating a sentence or a charge actually makes it as if it never happened. So whereas expungement just kind of seals it or covers it, vacating a sentence, removes it completely. So it's a different level. So we're looking at both of those. I think legislation around that will be submitted. And I think a couple of legislators will put forward a partial decriminalization bill, which I think would be exciting.
Do you know when that might take place?
Maybe next session. I'm not sure. I won't be leading the charge on that. You know, my role, and I try to keep good role boundaries, my role is really to develop knowledge around things with people most impacted. And then obviously if I get called to testify, and I'll do all of that. But I don't typically lead the charge on advocacy or legislation.
What advice would you give somebody who is an advocate, who does want to lead the charge or be a member of a charge? How do they even start if they don't have this in their state or they don't even have conversations around it? What would you suggest that they do?
Yeah, I think that's a really good question. So the kind of approach that I use is something called action research. And, you know, there's all kind of academic-y, blah-de-blah stuff about it. But when you boil it down, what it really means is making sure that when we're gathering information, that we really include people with lived experience in the process of figuring out what questions should we ask and how should we ask them. So I guess what I would encourage people to do is, you know, like if somebody's in social work practice or working for a nonprofit or a government agency that serves low-income people, you know, include people that you're working with in conversations about how to even ask questions about this stuff, because they're going to know better than anyone how best to approach the issue because they've been there and they've had those experiences. So for action research, it's really about partnering with people and getting as many perspectives as you can and thinking about what questions are the right questions to ask and what words are the right words to use. That's how I started in this work, you know, almost 15 years ago, was by working with people in a community to try to figure out what was going on with street-based prostitution. And then over time, I just realized, gosh, the people who really, really and truly are experts in this are people who have been involved in street-based prostitution. And so they're the ones who actually know.
So if somebody's on a coalition, an anti-trafficking coalition, or maybe they're not even on a coalition, the first thing they could do is look up to find out if there's a local coalition and then join it. But if they see this coalition working and going about its business, but they really aren't talking to survivors, they aren't really talking to sex workers, people involved in transactional sex, and they're starting to make decisions. Can you offer any tips on what this person can do if they're sitting there and all the decision makers are at the table making decisions about people who aren't even at the table?
Yeah, I think that happens a lot. And I think people who are at those tables have an opportunity. I mean, the first thing to do is even just say, hey, why aren't we including survivors in this? Or could we include survivors? In most states, there are nonprofits or groups that work with survivors. There might even be survivor-led organizations. I know there's a couple of national survivor leader organizations that people could reach out to. I just think that perspective is so important because the well-meaning people who don't have personal experience or lived experience are really important, but there's such a high potential for unintended consequences, things that we think might be good ideas that turn out to actually be catastrophically bad for people. It's just super important to have that perspective of somebody who's been in the life, who has lived experience, to really point out our assumptions and potential unintended consequences.
And so they can look around locally and see if there are survivor-led organizations. You mentioned some national groups. Do you know any of those groups, the names of any of those groups offhand?
There's one, I believe it's called Survivor Alliance. I'd have to look.
Okay. The Survivor Alliance would be a good place to start.
I think so.
Yeah. I think when survivors get to the table, or sex workers, or however people want to define themselves, when they get to the table, Are there certain things that coalitions or commissions can do to equal the playing field? Because I could imagine it being pretty intimidating for some folks. How can they make people feel welcome, participatory, like their voice is as important as an executive sitting there?
Yeah, I think that's really important. And the research that we do, we work really hard to create processes that are supportive. And a couple of principles that I want people to kind of look at. First of all, recognizing that people with lived experience are experts. They're not there to tell sob stories, or we don't want to re-exploit people by inviting somebody with lived experience and then expecting that the contribution that they'll make is to tell their story. Some people find great value in telling their story, but if people with lived experience are invited to be part of a process, they are there as experts just like anybody else. And, we don't expect a police officer to tell their personal story, right? We would ask a police officer their professional opinion. So if survivors are part of a coalition, they are there to provide their expert opinions.
Yeah, I love that you said they're there to provide their professional opinion as an expert. One of the things that you've done, I know you are the roll up the sleeves, get it done, not do the research that collects dust somewhere in the library. And so I know you've done a cost benefit analysis before, and tell people about that and how they could possibly use that in any grants or funding, or if they're trying to convince somebody to put money into a project, how can they use your cost benefit analysis and what is it?
Sure. That project came about when Safe Harbor in Minnesota first passed in 2011. There were a lot of questions about whether or not the state legislature would actually invest in supportive services for people. So I was actually commissioned by the Minnesota Indian Women's Resource Center to do a benefit cost study, really to make the case, if there was truly a case to be made, that this would be in the best interest of Minnesota taxpayers. Most of the work I do, I partner with people. So I partnered with an economist to do this study. His name is Rick Lotspeech. I actually met him at the Toledo conference that you've been holding all these years, Celia, and he did a presentation there. And I just, I thought, oh, here's a guy who kind of gets it and seems like he might be interested in doing a different type of a project. The way we approached that was we wanted to model how much money would the state save if they invested in early intervention to prevent sex trading and trafficking of young people. So for us, benefits would be the harms avoided, and the cost would be whatever the state would need to invest. And what we found was for every $1 that the state invests, they could see as much as $34 in return, which is a humongous return on investment. And really what that says is that there are a lot of harms associated with young people being involved in transactional sex that public agencies in the state pay for. And we didn't even model all of the costs that accrue to communities and families and nonprofits. We only looked at costs that are spent by taxpayers.
That's amazing. I still use that study, that cost benefit analysis. I still use it in almost every grant that I write. I think it has done wonders for people who are trying to convince their city or their state to invest in this issue. I think it's been fantastic. Do you know what it's called and where people can get a copy?
Yeah, there's actually two versions of it. There's the original version that we did for the Minnesota Indian Women's Resource Center. And that one people can find on the Minnesota Indian Women's Resource Center website. If you Google MIWRC or Minnesota Indian Women's Resource Center, you'll find their website. But then Rick and I also published a version of it in the Journal of Benefit Cost Analysis. And that's more of like a technical description of the model. So if somebody in, a different state or whatever wanted to take the model and apply it in their context, I would recommend using that published version because it's more refined and technical. We had a lot of other economists and stuff kind of help us fine tune that model. But I'm so thrilled to hear that this study is useful. We did it because we wanted to provide something that would help illuminate the cost to society of harms that happen to young people. So I'm thrilled to hear that you find it useful and that it's actually helping to make that case in your in Toledo and Ohio.
It's an amazing study. And can people get a copy of any of the strategic planning that you've done around Safe Harbor, or is that not written up yet?
Yeah, it's written up. It's all available. And that is on our website at UROC. And the web address for that is uroc.umn.edu/sex trafficking. And we've done a ton of different reports, big and small. They're all on that website. There's probably 15 different reports looking at the Safe Harbor for All. We did the benefit cost study. We did a study looking at people who are purchasing sex in Minnesota. And then we did a study trying to understand sex trafficking operations in Minneapolis. And I did that one in partnership with Sandy Pierce, who's a sociologist and also a survivor leader.
That's excellent. Well, and I know that you're moving from UROC to the School of Nursing at the University of Minnesota. So do you have anything coming up? What's on the horizon? What are you looking at in terms of your next research study or action research?
Yeah, right now I'm actually doing a project with a couple of engineers funded by the National Science Foundation. So there's this whole field called a whole field of engineering, looking at operations research, particularly focused on supply chain. So these are engineers who use mathematical models to figure out, okay, how can Amazon deliver packages more efficiently or whatever. And so I'm teamed up with 3 engineers, one at the University of Minnesota, to kind of figure out, is there a way that we can model supply chains and human trafficking operations in such a way that we can figure out how to disrupt how those operations build their supply chain.
Oh my God.
I know it sounds kind of gross because we're talking about humans.
That sounds so exciting. Like, I love that idea of that next research. Do you know when you might have some preliminary data coming out about that?
Probably in a year. So we're partnering. So we've got this engineers, and then me, I'm a social scientist, and then we have an expert on labor trafficking who's part of our team. And then we're also partnering with the Minnesota Bureau of Criminal Apprehension because we're going to be reviewing some of their cases. And then we're creating a kind of practitioner, survivor of trafficking advisory group who is going to be kind of our experts in making sure that we're not doing anything stupid. So they're going to review everything and make sure that, when we look at mathematical models, it's all about assumptions that you put into those models. And so we want to make sure that our assumptions are correct. We need to have experts with lived experience and people who work with survivors to kind of make sure that our assumptions are not off base or stupid. So
that's excellent.
So that's going to be coming out soon. Well, probably in a year for our preliminary stuff. But I think this will be a long-term collaboration.
And so, Lauren, where can people get in touch with you if they want more information about all the things that you're doing?
Sure. That website at UROC has a lot of good information about our work and our team. We have a whole team at UROC who's doing this work. And then obviously people can email me if they want. And my email address is on the website. I don't know if I guess I could give it here too. It's Mart, M-A-R-T, 2114 at umn.edu. Yeah, and I would just really encourage people to think about making sure that if they're going to work in the sphere or the domain of human trafficking, to just make sure that they're really in tune with people with lived experience so that they don't go off base and, again, do something that seems like a good idea, but that in practice is stigmatizing or harmful.
Yes.
We've seen that well-meaning people just doing something that just doesn't make sense, given the life experiences of people involved in commercial sex.
That's right. That's exactly right. Well, thank you so much, Lauren. I appreciate the time that you've given to be able to do this, because I know you are a super busy woman and about your business. I appreciate you spending the time to let the listeners know, and they want to not just do something, they want to do the best thing. Hearing from you puts them that much closer to doing the best thing. So thank you so much. I appreciate the time. And do you have any last parting words?
Yeah, thank you so much for inviting me. And Celia, you have been such an inspiration to me over the years. When I first started in this work, the first professional conference I went to on this topic was the Toledo conference. It was so reassuring and affirming to go to a space with experts like you that, you really held the doors open for everybody to participate and created a platform for people to be there on equal footing, practitioners, academics. It was beautiful for me to go to that conference the first time. And so thank you for everything that you've done. And thank you for being such an awesome and inspiring role model for me as I think about and thought about how I wanted to do this work in a way that makes impact in the world.
We've been talking to Dr. Laura Martin, and she reminds us to include survivor thrivers at the table and not get involved in passing any law, developing any policy, or creating any program without them, their opinions, and their voices. She reminds us that we're never sure if the person we arrest is a woman in street prostitution, who, by the way, is often a person in need of social services, or is a victim of sex trafficking. Actually, in Ohio, we did a study across 5 cities, and we found that women in street prostitution had similar experiences as victims of sex trafficking. Each suffered pervasive and frequent violence, were at high risk of drug addiction, HIV, and had poor mental health as a result of their experience in street prostitution. Minnesota may be deciding not to take the chance in re-traumatizing victims that have already been traumatized. This was reportedly the decision across all types of groups that they brought to the table. I know Lauren would say that she's not solely responsible for bringing these people to the table, but her personality, her approach is all over this type of work. She most reminds me of what Defina Lazarus Stewart said. She says, diversity asks, who's in the room? Equity responds, who's trying to get in the room but can't? Whose presence in the room is under constant threat of being erased? Inclusion asks, has everyone's ideas been heard? Justice responds, whose ideas won't be taken seriously because they aren't in the majority? How can we change that? Diversity asks, how many more of this group of people do we have than last year? Equity responds, what conditions have we created that maintain certain groups as the perpetual majority here? Inclusion asks, is this environment safe for everyone to feel like they belong? Justice challenges, whose safety is being sacrificed and minimized to allow others to be comfortable maintaining dehumanizing views? In fighting human trafficking, we need diversity and inclusion, but we also need equity and justice. If you like this episode of Emancipation Nation, please subscribe and I'll send you the weekly podcast. Until then, the fight continues.